cognitive behavior therapy, CBT. CBT not only focuses on a client's feelings, but also the thoughts that trigger these feelings. According to this approach, a thought cognition is a behavior that through automatic self-talk can affect our feelings. Oftentimes these thoughts are distorted and irrational. As humans, we have a propensity to engage in self-defeating negative self-talk. Since these negative thoughts are behaviors, they can be modified. A negative irrational thought can be changed into a positive rational thought. An irrational thought may include minimization or black and white thinking. As a result, through an educational process, the therapist can help the client become aware of these negative thoughts. Furthermore, through functional analysis, the therapist can help the client identify specific situations and other emotions that influence these thoughts. Once clients attain this awareness, they can work with the therapist to develop skills that challenge and reframe them, resulting in more positive thoughts as well as feelings. How is cognitive behavior therapy effective counseling treatment? CBT is a short-term therapeutic treatment that utilizes a variety of different approaches and interventions. The therapist is an educator and works collaboratively with the client to develop necessary skills to deal with problematic issues. Clients often work on homework assignments to hone these skills. Predominant approaches include Ellis's rational emotive behavioral therapy and Beck's cognitive therapy. Numerous research studies have confirmed the ability of CBT to effectively treat mental health issues including PTSD, depression, anxiety, and panic attacks. Is CBT really the perfect treatment, or does it have some flaws? While CBT is an effective therapeutic treatment, there are limitations to this approach. For example, a therapist must undergo extensive training, and this treatment focuses on the present rather than emphasizing a client's past traumatic experiences. Furthermore, determining which thoughts are irrational is subjective. It is important for the therapist to allow the client to discover which thoughts are rational and how to go about changing them. During our presentation today, we will uncover how CBT can be an effective therapeutic treatment for our client, Mandy. These interventions will focus on treating her substance abuse as well as night terrors. We will also reveal other important CBT interventions that can be used to treat a variety of mental health issues.
Hello, Mandy. How are you?
I'm okay. How are you?
Very good. Alright, so in our last couple sessions, you revealed that you've had a hard time trusting men. You've had self-confidence issues, and I think that this stems from your past, from your sexual abuse, and very traumatic past that you've had. I just want to know. I was wondering if you could tell me what you feel when you wake up from these night terrors that you've told me you've had, and what causes your insomnia, what your thoughts are when you wake up, and what you do after you wake up.
Well, I'm sleeping and all of a sudden I wake up around like 2 a.m. and I'm all sweating and trembling and my thoughts are racing and I feel kind of sick in my stomach and I have a really hard time going back to sleep. Sometimes never able to go back to sleep. Throughout the day, I would be in a bad mood and be distracted, can't focus on my work. I take sleep medications, but they don't help, and I think that the days that I'm working with my clients who have been sexually abused, I have night terrors that get worse.
Okay, so to me, one thought or feeling that you think when you wake up from a night terror.
Well, I think that I'm more anxious and I feel like I might not be able to go back to sleep ever.
Okay, so let's challenge that thought. Have you been able to go back to sleep after a night terror before?
Yeah.
Okay, so what is a more reasonable thought?
Well, if I have done it in the past, I could be really good.
Okay, so think more positive. Is there anything else that you think when you wake up from a night terror?
I can't. I feel anxious and stressed, and I can't deal with another night terror because they make me really angry and frustrated.
Okay, so you have been able to deal with your night terrors in the past, even after you had your first or your second. You have been able to deal.
Yeah, sort of.
Okay. So instead of thinking that you'll never be able to go back to sleep or you'll never be able to deal with another night terror, what is a more rational thought?
Well, since I have done it in the past, but it's not always that it doesn't work all the time.
Okay. So from now on, I want you to do something for me.
Okay.
I want you to record your thoughts and feelings in a journal when you have a night terror. So whenever you have a night terror, record how long you slept until you had your night terror, what you thought after you woke up from your night terror, the quality of your sleep, anything associated with your night terror and your sleep quality, so you can better understand how these night terrors and insomnia are affecting you and how we can better treat you in the future.
Okay.
Okay, so I'm going to do something with you now. I'm going to do what is called a muscle relaxation technique to help you fall asleep after you have a night terror. Alright, so now just relax back into your chair. Don't be nervous. Alright? I want you to close your eyes and take a deep breath. Alright, exhale. Alright, do one more time. Alright, and as you're exhaling, feel just all of the pressure and stress just leaving your body. Nothing else, anything else. It's okay. Would you like some water?
Yeah, I'll got some.
Alright, go ahead and breathe again. Just once, just so you relax.
Okay.
Just feeling all of your stress leaving your body as you. Alright? Now that, if you feel your mind racing to any other place, just focus on the just focus on the muscle that you are trying to relax. So right now it's just your breathing. So if you start thinking anything else, just think about your breathing, your lungs. So now I'm gonna only do 2 or 3 muscle groups with you, but you can do with your whole body just to help you relax. You basically just sort of contract your muscles and then for a couple of seconds then you relax. So for example, just relax, close your eyes, and I want you to shrug your shoulders as if you could touch your ears. Hold for about 5 seconds. And release and just feel the heaviness of them and how relaxed you feel. Just don't think about anything else. Just relax. Now I want you to shrug your upper back as if your shoulder blades can touch and hold and just release. And once again, just focus on that one muscle part. Don't think about, try not to think about anything else. If your mind starts racing and wandering off anywhere else, come back to that muscle and relax. Alright? Alright, so this is just an example of what you could do if you have a night terrors. Just a technique to help you relax.
I'm sorry.
That's okay. just a technique to help you relax. All right. Now that we've gone through 2 or 3 muscle groups, how do you feel now?
I feel good. It's relaxing.
All right, good. You mentioned in the past that there are other things that help you relax and take your mind off of things and could possibly help you with your night terrors. Well, what could those things? Can you tell me about them?
Well, I sometimes, when I wake up, I just drink something or read a book or something to help me fall asleep again.
Okay, so next time you have a night terror, perhaps walk around a bit, drink some water, have a snack, read your book, and just try to take your mind off these night terrors and the things that you've been dreaming about, and keep practicing your muscle relaxation techniques. And I want to discuss if this helped you next week when I see you. And just be wary if you have any problems, if there's anything stressful in your day. I know you said you have your sexual abuse victims. Maybe they stress you out. Maybe talk to your colleagues about your problems, and just seek any help that you think might help you to prevent or even after your night terrors. Okay? So it seems we're out of time, but I'm looking forward to see you next week and see if any of these techniques that I shared with you help you. And remember to write down your thoughts and feelings after you have your night terrors in the journal, and we'll talk about them next week.
Okay.
Okay. See you next week. Hello, Mandy. How are you?
Good. How are you?
Very good. All right. So today I want to focus on your substance abuse and alcohol abuse in the past. So you told me that right now you're clean and sober, trying to set a good example for your patients, your sexual abuse, and for your patients that you have. But you said sometimes you have cravings that you want to take these drugs and you want to drink. Can you tell me what you're thinking when you have these cravings and what you do and your feelings?
Well, I start having flashbacks about what happened in the past, and then it happens sometimes when I'm talking to my clients, or sometimes when I'm talking to my mom, and those flashbacks, they come with like a lot of anger and rage. I experience a lot of anger, and I feel just very hurt, and I just want to stop the pain, so I start drinking and take a lot of pills. I told you I had arthritis before, so when I'm going through that experience, my arthritis pains gets worsened, so I take more pills, but I kind of know that I'm taking too much. I just want to set a good example, as you said, for my client, because I just received my degree, and I want to get better and move forward.
Okay, so can you tell me any specific thoughts that you have before you take drugs or have cravings to drink alcohol? Or what do you do? What are you thinking? Your feelings?
Well, I feel like I'm worthless, and I feel like I don't deserve to be happy, and this is all my fault.
Okay, so is there anything else that you think you could substitute these cravings for drugs or anything like that?
Well, what do you mean by substituting?
Just instead of saying, "Oh, I need these drugs for your pain, for your arthritis or whatnot," or you think you have cravings for alcohol. Do you
Yeah,
think
I
you could do
think-
anything else instead of taking drugs or drinking alcohol?
I do think that I have to take the to drugs to just make me feel numb and stop the pain.
Okay, so
Like I have to.
let's challenge that thought. Do you have to? Do you have to take these drugs? Do you really believe you have to take these drugs? Or is there anything else you could do instead of taking these drugs to make you feel better? Is there anything else that makes you feel good?
Well, before it all really got triggered, I used to call my friend Cindy, and I was able to talk to her about my problems. She was very open, and I used to go out, just go to a coffee shop or shopping or distract myself instead of going to a bar, you know. But
Okay. Well, do you think you could do that instead of have, having to take these drugs or having these cravings to take drugs? Maybe instead of when do you think you're having these cravings for taking the drugs, maybe you can substitute it by calling your friend to help get your mind off of these things, or maybe you can start exercising to get your mind to think about other things, to not focus on the drugs. Do you think that's a possible thing you could do to help you with your cravings of drugs and alcohol?
yeah, perhaps I can do that.
Okay. So, what is another thought that you've been having?
Sometimes I feel like I think that it was my fault and I don't deserve to be happy.
Okay, so let's challenge that thought again. Do you think that you, as a child, when you had this very traumatic experience of the sexual abuse, do you think it was your fault? Don't you think that you deserve to be happy?
Well, I do think that I deserve to be happy. Everyone else gets to have their happy ending, and why can't I have that?
It's good that you're thinking this way. So, as we discussed last week, have you been keeping up with keeping your thoughts after your night terrors and recording everything, how your sleep quality, how long it took you to fall asleep, how long you slept? Have you been keeping up in your journal?
Somewhat, yeah. I'm trying to stay on top of it.
Okay. So, do you think that's helped at all?
I think so, because it keeps reminding me of like all the things that I'm doing and all the things that I shouldn't be doing. So it's just a reminder.
Okay, that's good. So now, in addition to recording what you felt after your night terrors and your sleep quality and all that, I want you to do the same thing about your drug and alcohol cravings. Whenever you're having a drug and alcohol craving, I want you to write down why or what you're thinking when you're having these.
Excuse me.
It's okay. What you're thinking when you're having these cravings, what you're feeling, what you could possibly substitute in order and for these things, so you can monitor yourself, and so when we come in here, we can have a basis to help you, just try to keep you away from those negative things in your life. So, I mean, just the things that we've been talking about, you can substitute. I mean, you said other things that make you happy and that you could possibly substitute with these cravings for drugs and alcohol. So you call your friend Cindy, go shopping with her, start exercising, go to coffee shop, keep reading your book that you told me about last week. Just try to do anything to distract yourself from thinking about those things, because the number one thing about now you as a person, and now even more so that you yourself are a counselor, is you need to worry about your own self-care first. As an analogy to this would be when you're in an airplane The airlines usually tell you for you yourself, to put on your own oxygen mask first before you put on the oxygen mask of your own children, because if something happens to you during anything bad that can happen on a plane, who will take care of your children? If you pass out, how are you going to help them in the future? So this is the same thing. You need to make sure you yourself have your own, you take care of yourself, have good self-care before you help out anybody else. I know you care about your patients and you really want to help them, but it's essential to first take care of yourself before you can help anybody else, and including your own patients. Okay?
Yeah, I've been thinking about that. I live with my mother and I have to care for her as well, so I think that I need to care for myself first.
Yeah. It's not bad that you care for others, because it's a good quality to have, but first and foremost, you need to take care of yourself, because nobody else will if you don't. Okay?
Yeah.
All right, so it seems we're out of time. I want to thank you for coming in today, and I hope to see you next week.
Thank you.
Bye-bye.
Bye.
CBT is very effective for treating clients that are dealing with depression. The first step for an intervention would be to educate the client and have them understand that their symptoms are a part of an illness that can be treated. The next step would be to have the patient realize that negative thinking is part of what causes negative emotions. Most likely, if the client is depressed, they are thinking negatively about themselves or about some aspect of their life. For example, if a client is always saying something like, "I'm a loser, I won't accomplish anything in life," the counselor should help the client realize that sometime in their life things were much better and they have made some accomplishments along the way. The counselor could use the fact that the client has showed up and is willing to work on their problem, so the client is taking steps in the right direction, and that is an accomplishment within itself. Now the counselor should start having the client think more positively of themselves, so the client's behavior also starts to be more positive. For example, instead of thinking they're a loser, the client may say something like, "I may not have reached my goals yet, but I am making progress towards them." Once the client is able to think more positively, they will most likely be able to act more positively.
My name is Jocelyn Diaz, and my intervention is suicide ideation. An average of 9 hours of individual CBT sessions for preventing suicide has been stated to decrease the chance of repeat attempts in nearly 50% of patients. Looking at it from a theoretical perspective is using the Ehrenbeck's suicide mode. The considered mechanism of action associated with CBT for preventing suicide can be described as 1, deactivation of the suicide mode, 2, the change in structure and content of the suicide mode, and 3, the construction and repetition of more adaptive structural modes to increase the desire to live. There are 3 phases of therapy for suicide prevention, and they include 1, telling a story connected with their most recent experience of suicidal thoughts, behavior, or both. 2, the patient is supported with changing underdeveloped or overdeveloped skills that are most closely linked with the risk of activating a suicidal crisis. And 3, the patient is conducted through a relapse prevention task. The purpose of this exercise is to 1, highlight skills learned during therapy, and 2, let the patient practice active problem-solving tactics that are meant to reduce the reoccurrence of suicidal violence. Going more into detail, phase 1, you will engage the patient in treatment, collaboratively produce a safety plan, and develop a cognitive behavioral conceptualization. And in phase 2, you build skills to avoid episode of suicidal violence, create a hope box or make coping cards. And in the last phase, they complete a relapse prevention task like I had mentioned before, and are provided with psychoeducation. They restate their suicide story, apply CBT skills, generalize their learning to prepare for future suicidal situations. They debrief and review lessons learned. To wrap up my intervention, therapists must ensure that the safety plan contains contact information that the patient can reach the therapist themselves, in clinic, the local 24-hour or our emergency department, and the 24/7 National Suicide Prevention Lifeline, which is 1-800-273-TALK. That is 1-800-273-8255. Thank you.
My name is Ana Viveros, and my intervention is disputing irrational beliefs. An intervention used in this treatment is disputing irrational beliefs. Disputing irrational beliefs is when we teach the patient that instead of asking negative questions, they should ask them in a positive note. Disputing irrational beliefs intervention encourages the patient to replace the negative thoughts with more rational and realistic versions. The goal of the therapist is to teach the patient to see his or her life belief in a positive or better way and ask less irrational questions. For example, questions like, why is the world against me? Or why do people dislike me? The patients learn to replace those negative beliefs and start thinking like, people dislike me and that's okay. Not every person has to like me. And the world is not against me. I'm just going through a rough time now, but I will survive. Finally, the patient should be aware and keep notice of their feelings so they can learn how to make changes in their behaviors.
Our presentation today revealed how CBT can be used to effectively treat mental health issues, including substance abuse and night terrors. The CBT interventions allowed Mandy to have a better understanding of her irrational thoughts and ways to reframe them into more rational thoughts. By changing these thoughts, Mandy should experience more positive feelings. As we have shown today, CBT is an important approach to include in any therapist's repertoire of therapeutic techniques.